Spider-Man, Wolverine,
Black Panther, Wonder Woman.
These superheroes may be impressive on the big screen, but they're not real.
We'll talk to an REAL, real-life superhero who lives right here in our community.
Next, on Loving the Springs, the podcast that celebrates the best of Colorado and Manitou Springs and strives to elevate the rest.
You're listening to Studio 809 Podcasts, the cure for common apathy and indifference. Reported side effects include a sense of being informed and engaged. Ask your doctor if Studio 809 is right for you.
I'm Al Brody.
And I'm Dave Gardner.
We're coming to you from the Studio 809 Community Podcast Studio at the Next Us, a professional cooperative environment for small businesses in downtown Colorado Springs.
We're recording this episode on December 6th, 2024, and we are still looking for a third co-host. So if you're interested, email us at studio809podcasts@gmail.com.
In this episode, we're talking with an impressive young lady, Jennaya Colóns, President and Executive Director, Highroots Wellness and Consulting, Certified Brain Injury Specialist, Physical Therapist Assistant at CommonSpirit.
Welcome, Jennaya. Thanks for joining us.
Thank you for having me.
What the heck are you doing here? What brings you here?
Well,
you're busy.
I am a very busy woman, intentionally busy, though I would say. So thank you for having me again, because I am here to really spread awareness of our amazing nonprofit organization that was founded a year ago, October of 2023. And we are Highroots Wellness and Consulting, as you had mentioned. And our goal as a nonprofit is to really improve community health. We plan to do that by our mission, which is listening to personal experiences and uplifting voices. And when we really listen to the information that people provide us and we pair that with research and data and resources, we make meaningful solutions with the people of Colorado Springs. And that's important because when we're looking at health happens in communities. Right. And so empowering our community members, our community-based organizations to really take a place in our health and improving our outcomes is really important to help us all thrive in our city.
Well, that's just an interesting description. It doesn't sound like anything I've ever heard of before. Is it one of a kind?
I would definitely say Highroots Wellness and Consulting is one of a kind. I have worked in healthcare for a long time. So CommonSpirit, I still am a clinician there. I am also an outreach liaison in the cancer center. So my role as a physical therapist assistant, I've been doing that for 10 years. And my goal and my job description is to help people get back to health, right? Mm-hmm. But what I quickly saw in that field is that a lot of health isn't impacted by what I can do in my clinic, right? A lot of people's health is impacted long before they get to me. It's impacted by their community. It's impacted by their family members. It's impacted by their environment. And so then that really transforms to how I interact with them, because it impacts how they're coming in, so their initial state of health, but then also what are their outcomes that we can achieve. And the more social barriers an individual has in their life, whether that's economic stability or a lack of social support, that's going to then impact their outcomes that I can give them, right? If they don't have a way to get to me, if they don't have a good supportive system at home that's going to support their health, their outcomes aren't going to be great. And what's the negative impact of that? Well, now that person can't participate in society like they can and should be able to. And I have 15 visits in physical therapy to help someone get back to health, right? That's not realistic to be done in the hospital.
Yeah, I guess that makes sense. So it's sort of like super holistic medicine that you're doing at Highroots Wellness.
Yes, that's a great way to look at it, because it's all connected, right? We're all connected.
So where do you plug into the community?
Awesome question. So first, I'm just highly involved in the community, but when it comes to Highroots, our goal is to interact with community members and community-based organizations specifically. So community-based organizations, they already interact with community members every single day with their social supports, their social needs, right? And a lot of these community-based organizations already have information that others may not have. And what I mean by that is such as income levels. They might have access to, this family has housing needs. They have these needs that maybe the person hasn't gone to, DHS, or they haven't gone to an actual government support system, right? They're going to nonprofit organizations in their neighborhoods to get these needs met. And so partnering with these community-based organizations gives us the best insight, and it allows us to not recreate the wheel because we're partnering with someone who already has a strong connection with community members, and they already have an intimate understanding of what the community members are going through.
So it'd be something like, I'm just going to pull one out of thin air, like Westside Cares. Maybe they recognize that one of their clients has some needs that they alone can't fulfill. They would refer them to you?
Good question. So the way it would actually work, and I'll use an organization that we recently just worked with.
Okay.
So Peak Education, they are a nonprofit organization that helps youth who are low-income first-generation kids get to college. These kids go to college for free. They help them write scholarships. They have a mentor system, a very strong mentor system, and they follow these kids from 7th grade all the way through college. And so what I saw was, wow, there's already an organization who is addressing a health need, which is education, right? Education is the basis of our health. And so what I thought was, how can I connect with Peak Ed to A, highlight what they're already doing that is improving our health, and how can I B, really increase support around Peak Ed so that we can continue to increase the access to resources that they're providing? And third, how can we tie Peak Ed into the social support system? So, for instance, Peak Ed's kids, 75% of them live 200% of the poverty level or below. And that means that the majority of those kids are going to qualify for certain programs like SNAP, food stamp assistance. And so we can then take the information that Peak Ed has and connect those youth with, hey, here's the resource that you need. The reason why I specifically highlight SNAP is because in El Paso County, 34% of individuals actually receive the SNAP benefits that they're eligible for, which means 64% are eligible and do not access their benefits.
Wow.
And this is important because when people access those benefits, it can actually pull them out of poverty. And then they can actually, right, they're eating healthier, they can go to work. Right now, they can actually get lifted out of poverty and then better their lives over time.
So are you working one-on-one with those kids at Peak Education, or are you more involved in some kind of interrelated programs, or both?
Good question again. The way it works is we are coming alongside Peak Ed to, like I said, continue to support what they are already doing well, but then complement what we think they could do additionally to help improve health outcomes. And again, starting with education is vital because education is the basis of our health. And so when you look at Peak Ed, what's really amazing about them is these youth, they graduate at 100% graduation rate. And a lot of these kids, the schools that they attend, so predominantly Southeast Springs, Mitchell, for instance, Mitchell High School has a graduation rate of 53%. Some of the other schools are 73%. And Peak Ed kids graduate at 100% graduation rate, and 100% of them go on to college. So I said, well, let's look deeper at what are these kids' interests, because they want to go on to college. And what we also know is that there's a workforce shortage in healthcare. And so I'm like, we can really address this in multiple ways. We can look at the needs of the kids that they're serving. We can increase their access to social support, but then we can create a sustainable solution that really develops workforce. So what we are doing with Peak Ed is we are hoping to create a youth health ambassadorship program. And the youth, 33% of Peak Ed youth are interested in a health career. So I did a community needs assessment, and that was one of the things that we found as we're going through this. And what's even more exciting about this information that I found is when you look at the area that these kids come from, right, and again, a lot of them predominantly Southeast Colorado Springs, that area has worse health outcomes. They have higher uninsured rates. There's higher diesel fuel particulates in the air. There's higher wastewater, right? There's a lot of health issues in that area.
Yeah.
And what we know about healthcare is the best way to address problems is by looking at the community that lives there, because they are experiencing it and they have the solutions. So if we look at these kids, we can see, okay, how can we grow you in our workforce, but really also take a look at how well you know the community that you're coming from and what's the power in that. And so the Youth Health Ambassadorship Program allows youth to become a community health worker. And a community health worker is a position where it is an individual that is from the communities that they serve, and they help bridge access to resources. They help fill gaps. They listen to stories, and they really find actionable solutions based off of not just what the numbers tell us, which is important, but the why, which comes from people's stories. And so we're looking at really building a big, sustainable workforce, essentially, by collaborating with community-based organizations.
This is fantastic, because recently, and I haven't checked for a few years, Colorado was the least obese state in the nation.
Used to be, right?
Well,
Or are we still
I
a little
believe
better?
we still are, but we were catching up at an alarming rate. So even though we were the least obese state, we were changing. And if you go to a place like Boulder, Boulder is one of the healthiest cities in America. And if you go to a place like Pueblo, Pueblo is one of the most obese cities in America. So now we're dividing Colorado Springs into the quadrants. And what I'm hearing is the Southeast may be much more like Pueblo than like Boulder. So when you average things in Colorado Springs, you don't get a representative picture of what's actually going on. And the Southeast, but these health ambassadors sound like the answer. I mean, what a fantastic tool to have in a community. That's great.
Thank you.
So who should call you? If there are individuals who think that you can help them, are you happy to hear from individuals, or are you working mainly at a higher level where you just need to be interfacing with other organizations to implement these programs?
The most effective is both. So we also host Rooted in Wellness workshops. And so these Rooted in Wellness workshops are a way for us to directly connect with community members and get feedback like, what do you see in your neighborhoods? What do you know about health? What are gaps? What's important to you, right? Because what's important to one neighborhood or one individual is going to be different for another. And so, again, when we're looking at what are solutions, we have to really talk to individuals. Now, when it comes to navigating an individual through a resource, because that's what always comes down to, right? We always have access to resources, but do I know what resources is best for me? And do I know how to get there? And do I have access to it? So many layers, right? And so navigating a resource, what I would do is connect, again, with community-based organizations to say, find out what the individual's need is, but then point them in the right direction of an organization that is going to best support them. And then the overall goal of Highroots is to serve as a community care hub where we can be the central position where individuals can reach out to us, but then we can eventually have connections with community health workers throughout Colorado Springs where we can connect an individual with a community health worker so that community health worker can come alongside an individual and then help them navigate whatever they need assistance navigating.
So what are some of the best ways for the people out in our community to find you, follow you, become your fangirls and fanboys?
So the best way is you can definitely check out our social media. So we have Instagram and Facebook, Highroots_wellness. You can also go to our website, highrootswellness.org. That is also where you will find our most recent community needs assessment that we completed for peak education. And you will also find opportunities to find our upcoming events, such as our season of wellness brunch that is coming up. And then also you can find ways to participate with us. So volunteering, building capacity, because when it comes to community health workers, there's a lot of community health workers already in our community that might not even know that they are a community health worker, so to speak, right? There's people who are volunteering, who just are doing things out of the goodness of their heart. So there's lots of ways to connect with us and then find ways to get involved with us.
Tell us about that brunch. I'm hungry.
Yes. So on December 11th, we're going to be having a season of wellness brunch. And at that brunch, we're going to have a wonderful panel. And that panel is going to really showcase what I'm trying to say as far as community connecting with the health system. And so on our panel, we're going to have someone from education. We have a palliative care doctor. We have a nurse. We have someone from public health. And then we have a community member. And so we're going to really be telling the story about why it's so important to navigate resources, but then also why it's so important to address these support systems before people are sick. Because then that creates its own problems, right? So we're going to dive into a lot of that. And then there's going to be awesome, delicious food. So people can go to our website and go under upcoming events and find out how to register. It's $40 for a ticket. You get a discount, though, if you get 2 tickets. It's $35 per ticket.
Sad to say, by the time anyone's listening to this, the event's going to be past tense. Yeah. But there'll be others, right?
Yes.
Yeah, so it sounds like it's not like invitation only. The public is invited to attend. And
definitely.
Okay.
And there will also be the more rooted in wellness workshops coming up as well. Those are free to attend. The last one we had was at Stomping Grounds in Southeast Springs. And we were also invited to Widefield's, their new park and rec facility, to start in summer of hosting rooted in wellness workshops. So we're looking to expand and be everywhere. So if you look on our website, you'll see when our next ones will be coming up. 2
of my favorite venues. Love Jules over there at Stompin' Grounds. Love what she's doing. That's great. Have you been to Stompin' Grounds yet?
I have not. I have been to Panorama Park, and I assume that you've had something to do with that.
Well, actually, I did not have anything to do with Panorama Park. I am a big supporter of Panorama Park, though, and all that they have. I've been down there and I've participated in Rise Southeast has some amazing walks that they do on Wednesdays, and they go through Panorama Park. And, it took a lot of grassroots effort to get that park going. So, again, it shows the power of community, knowing what they need, knowing what they want. And so it's really exciting.
Yeah, and I think we should do a shout out to Yolanda Avila for doing a lot of the spearheading of that. And I hope that the Southeast Colorado Springs continues to have a voice like that, because we're sort of losing Yolanda from City Council.
While we're doing shout outs, Alan Beauchamp, and you must know him,
yes,
has a lot to do with the Rise walks and bike rides. So a shout out to Alan Beauchamp.
Yes, he is a wonderful man.
Yeah,
I appreciate him.
He's a legend in this community. So looking at the 2 million other things that you do in your spare time, I see co-chair of the hospital's Diversity, Equity, and Inclusion Council. That's CommonSpirit, used to be Penrose. Does it still exist?
It does still exist. So I had a term for 3 years. I am actually no longer serving as a chair, but yes, it does still exist. And, what's really important, I hope people take away from that, and what I want to really come through in this work that we're doing with Highroots, is that everybody does matter, every single last one of us. And when we're looking at how health outcomes impacts, yes, when we say, Southeast Springs, but what everyone really needs to wrap around is that impacts all of us when it impacts some of us. And what I mean by that is when you look at the grand scale of how much money we spend in this country on healthcare. So we spend 30% more than any other country, and we have the 11th best outcomes of any developed country.
I'm surprised it's even that good.
Right? We have the worst maternal death rates. We have terrible chronic disease rates. And so what happens when that is the case is it taxes our whole system, right? When people don't have access to social supports, that then turns into a catastrophe that then leads them into the emergency room. Like, who pays for that? Right? Like we all pay for that.
Sure.
And so being preventative is really important, because when you look at all of our outcomes, even the most healthy populations in our country have worse outcomes. And so really understanding that it is all of us. It's not just some groups of people, it's all of us. And that's what inclusion really means.
Very well said. Let's see, recent Mayor's Civic Leader Fellowship graduate, and I think we talked about in a previous episode. How did you find that? Tell us about that.
That was instrumental in a lot of this work that I'm doing. Highroots was actually started in the midst of when I was in my fellowship. Highroots wasn't a new concept. It had been a blog since 2015, covering these same topics: wellness, access, navigation, how communities can come together. But as I was going through healthcare, I kept feeling like there's more outside of the hospital that needs to be done. And so I joined the fellowship. And then as I kept going through every month, it was just continuing to solidify that I am right. The answers are in the community, not in the hospital. And so by the end, we were really posed with a question. We had different groups where we had to solve a problem that exists in Colorado Springs. And my group was economic stability. And there was a huge focus on, once again, Southeast Springs, as far as health outcomes, as far as transportation, as far as test scores. And the solutions always go back a lot of the times to workforce, which can be helpful, but not if someone's having issues with transportation and childcare and, right, the first things that are preventing it in the first place. So I just thought we have to get really creative. And at the same time, I'm going through my master's. I'm a community health worker as well in the cancer center. So I remove barriers. I'm actively doing this work there. And I'm thinking, okay, well, what if we create a workforce solution that also addresses the barriers that we're seeing? And that's how community health workers and the thought process of the Youth Health Ambassadorship Program came about. So the Mayor's Fellowship Program is amazing because every month you get to experience a different part of the city, whether it's transportation, whether it's learning more about our zoning, learning more about exactly what the mayor is doing, what the city council is doing, and the roles that everyone plays, our fire department, our police department. So it was eye-opening, insightful, and solidified my desire to do more in the community to improve health outcomes.
Any pearls of wisdom that you eked out of that experience when you meet with the different groups within the city?
There's a lot of silos that exist between and that's an issue that I don't think is unique just to the city. That's within organizations. That's within the city. That's within states, and right. And I don't think that the answer when there's silos is to put one entity in charge of everything. What I think is that increased collaboration needs to happen, and increased incentivizing of that collaboration needs to happen, because one part of the system can't do it all.
And that's why you go through the program. You become that catalyst to bring the different silos together.
Yes.
And I think you're doing it.
Thank you.
So,
What's at the top of your wish list? If we could grant you a wish, or if our listeners could grant you a wish, what do you need help with? What do you need us all to do?
I need support. So we need donations, definitely. So people can always support through donations so that we can help build our Youth Health Ambassadorship Program, so we can continue to support our Rooted in Wellness workshops. We also need people to volunteer. So definitely that, because we need to gather more research. We need to be on the ground gathering people's stories and really making sure we're capturing what people need and not making assumptions on what people need. And so we need that, and then we just need support. We need people to talk about what we're doing. We need to normalize that everyone is involved in health, right? I think people get caught up in like healthcare. Oh, that's that one sector. Health is every single day, right? Your health is every day. And so therefore we all play a role in our health and how our health impacts our economy as well.
I feel a little weird about all the talk about Southeast Colorado Springs. It's good that we're recognizing that Southeast Colorado Springs, that there's attention needed there. I mean, it's a food desert, a healthy food desert for sure, and there are a lot of challenges that are greater for people in that part of town than in other parts of town. But I just want to say, I don't live in Southeast Colorado Springs, and I live in an Amy's Donuts desert. I have to go to Southeast Colorado Springs to get my Amy's Donuts fix, which is, as you know, that's very healthy food. That's how I maintain my health.
I'm not sure how to answer that, Dave.
It's one of the few places you can really get a good donut still.
I remember when we got our first Krispy Kreme.
I love Krispy Kreme donuts.
Do you remember that, though?
Yes.
Oh, right, hot off the line. Yep.
And it knocked, just the existence of Krispy Kreme knocked Colorado Springs down a notch in the healthiest city rankings.
Yeah.
So I'm not so sure that's a good thing.
But no, that's a great question because, yes, how does this impact other people who are not in Southeast Springs right now? So the bottom line is that's just where our focus is right now because it has the greatest needs of resources, but we are expanding where that need is throughout. So, for instance, the next organization that we're looking at doing a needs assessment is on the west side of the Springs, and they really assist with the unhoused community. And so that's our next focus. So what I'm strategically doing is making sure that we end up painting a full picture, right? The way I look at community is like a puzzle. I feel like what we do as humans naturally is we categorize, right? We put people in boxes and we're like, this is how we're going to solve this problem. We're going to put you in a box. But here's the thing with boxes is people fall through the cracks because people don't fit in boxes. Each person is a unique puzzle piece. And when you're putting together a puzzle, that takes time and it takes intention, right? And, you know, sometimes you get that puzzle piece that you like try to put in and it doesn't fit and you think it fits, but it doesn't. And you have to acknowledge the fact that it doesn't fit there and remove it and find the piece that does fit. And that's what community is, right? It's intentional puzzle making, looking at where each person fits in the puzzle and how can we work together to make this bigger picture. And so it's starting small, right? Starting with Southeast, starting with these organizations on the west side, but then also building bigger, right? These are the areas that I know have problems, but there are probably lots of parts in Colorado Springs that I am completely unaware of what that individual neighborhood or community is facing. And so what I encourage people to do is bring that information forth to us. Let us help solve problems that you see in your communities, in your neighborhood, so that we can thrive better together as a whole Colorado Springs.
So Highroots Wellness is a year old. Are you able to pay any staff right now?
No, not yet. But, you know, we've had a very strong, impactful year. So we were able to receive a grant for our first year. So
Excellent.
We were able to fund definitely, you know, the workshops and some of our events and getting everything going. So that's been wonderful. And then that seed money has turned into a great relationship with the foundation that we received it from, which is Windy Pines Foundation. And so we're hoping to continue on that relationship. And then we're looking at other foundations that are very interested in our Youth Health Ambassadorship program. So that's phenomenal. And then we're doing fundraising. So far we've raised $1,000, over $1,000 this year. And so we are working hard and our goal is to expand to staff. So we have a couple of people on our radar who are very excited about Highroots, which makes me very excited that they want to work for us or with us in any capacity. So we're looking at building our team immediately as soon as we can get all of the resources. So again, another reason to donate to help us increase our staffing and really address these problems.
That's great because you're going to need a volunteer coordinator and you're going to need a CFO just to keep track of all the big checks that are going to come streaming in.
Exactly.
Different subject, but I have a question about libraries. When I grew up, I could walk to a library in the Bronx. When I was in the Air Force, I could walk to a library on base. When I lived in Rock Rimmon, I could walk to the library in Rock Rimmon. But that's changing. Is libraries or walkable libraries or walking to the library, is that part of health?
That is absolutely a part of health. The library is it's a resource hub, right? People go there, to learn, to read, to educate, but then everything else that's included at the library, right? It's accessible for people who maybe can't read. They have audio, right? And then there's resources, there's computers, there's so much more outside of just books that the library is necessary for. Printing, right? My printer, I have bad luck with printers. It feels like they're always breaking. And so the library printer is my friend, right? So it's so much more than just a place to read books, right? And it's a community. It's a safe place for our youth, right? And specifically in Rockrimmon, Eagleview Middle School, right?
You can go there for lunch, yes.
Mm-hmm. It makes me concerned about those youth that would go to Rockrimmon Library, and now they don't have that space. I lived in that area for 6 years, and so I love Rockrimmon Library. My boys, they are hybrid homeschool, and Trailblazer Elementary is their home base. And so when I drop them off for an in-person experience at the school, I am at Rockrimmon Library. So it is a big deal in my world as well. And so yeah, it matters, and it limits access. It limits access to information. It limits access to resources. I just feel like we need to make some important, well-thought-out decisions of how we can make sure there's a library in that area.
Yep. Good question, Al.
Yeah. And with that said, that goes into Ruth Hawley as well, because that was also in the conversation. And Ruth Hawley is by Mitchell High School, which is like more East Springs. But again, right, if you have an area where they have the lowest graduation rates, they have low employment rate, like, do you think that the people need the library for the resources? Right? Like,
let's take away their books.
Exactly. And then it's like, participate in the economy. Well, give people a chance to participate by leaving necessary resources intact. And when the community rallies together and raises $70,000 to keep a library open, such as Rockrimmon did, I mean, it's really hard to understand why we can't make the decisions to keep libraries open. And they're all so vital, right? When you look at the maps of how they're dispersed, like, leaving it so that it's accessible to everyone, I feel like where the library locations are, they're needed where they are. Because now there's a 20-minute commute to 21C or a 20-minute commute to Old Colorado City Library if you live in that Rockrimmon area.
Yep. One thing we ask every guest, because this is called Loving the Springs, what do you love? What do you love about Manitou and Colorado Springs?
I was born and raised in Colorado Springs. And, it's funny how we got here. My grandfather was in the Air Force, and they were stationed in Germany in the 80s. And at the time, the only thing that was really airing over there was the Denver Broncos games. And so when my grandfather was asked to be stationed back in the U.S., he asked my grandmother, do you want to go back to San Antonio or do you want to go to Colorado Springs? And she said, we are going to see John Elway. And so John Elway is the reason why my family moved to Colorado Springs.
Thank you, John.
Yes. And this place has a very special... It's just so special in my heart. My grandma was my favorite person in the entire world. So her love for Colorado Springs and the Four Seasons, I think, definitely rubbed off on me. But then I also moved to Arizona when I was a sophomore in high school, against my will, of course. And so I lived out there until my freshman year of college. And when I came back, a part of me was grateful that I had lived in somewhere else, mostly because I realized that not everyone has an amazing, beautiful mountain in their backyard.
That is true.
Right? I was like, oh, yeah, Arizona's flat and there's cactus. Some people find its own beauty. I am partial to the big, giant mountain in my backyard. So...
Good for you. I just want to note, this is audio only, so nobody, I think they can hear it. Jennaya has a sparkle in her eyes. We get to enjoy it here today. I hope you're enjoying it, listening to that sparkle.
It is amazing.
Yeah.
And of all the people we have interviewed, you are by far the easiest to have a conversation with. This is amazing.
Well, she's an incredible communicator. She's exactly the kind of person we need to be a co-host. We need somebody who's going to live a little bit longer than we are. But you're so busy, I'm not going to
but if you have
even
a clone,
dream about that.
We'll take it.
Yeah.
Thank you. Well, I attribute that to my my role as a physical therapist assistant for so long. So, I treat patients one-on-one for 40 minutes. I get to I'm an outpatient. So I see people for 6 to 8 weeks. I build relationships with people, right? I can see up to 13 people a day. My first year at Penrose, I saw 1,496 visits.
Wow.
Yeah, I set a record. And I love it, though, because I get to see all different walks of life. I get to hear from people from all different backgrounds. And I get 40 minutes and 6 weeks plus, sometimes more. And people come back, right? I have people who I've known for years who come back and request to see me. And so I get to hang out and converse with people all day. So I think that's...
I can see why they want to come back.
Thank you.
We don't have very much left in this episode, but we do have a couple of important things we want to do. And one is, Al, in our last episode, we called it the mean streets of Colorado Springs. And I'm trying to launch a crusade to get people to slow down and drive the speed limit so that pedestrians are safer and people feel like they can ride bicycles. And our carbon dioxide emissions go down because we're not driving faster, which is less efficient. So I said, I'm going to try to be a role model. And Al pointed out, you really need somebody cool to be the role model. Thanks a lot. And he pointed out that
I'm harsh.
and I wanted to do a fact check on Al because Al said that if you're driving down a 2-lane highway at the speed limit and there are 5 or more vehicles stacked up behind you because they want to speed down the highway, you're legally bound to pull over and let them go by. And I said, no way. And so I looked it up. I was fact-checking Al, but Al was right. Mm-hmm. It's called the 5-car rule. It's fairly common. And so here's what it reads. It reads, if any person drives a motor vehicle on a highway outside an incorporated area or on any controlled access highway at a speed less than the normal and reasonable speed of traffic under the conditions then and there existing, and by so driving at such slower speed impedes or retards the normal and reasonable movement of vehicular traffic following immediately behind, then such driver shall, where possible and it's safe, move to the side of the road and let the traffic go by. Now, the lawmakers were obviously getting paid by the word when they wrote this bill. Don't you think?
As they do.
Yeah. So, Al, you're right, probably. But I want to point out, in some states, it says if it's a slow-moving vehicle. And if you're driving the speed limit, you're not a slow-moving vehicle by definition. But by the definition of all the drivers stacked behind you, you are. But it's probably true that I have this obligation to pull over, that I can't just be the guy who sets the pace. I'm trying to re-normalize driving the speed limit.
Don't be that guy.
But normalize, that's funny that you say that because there is actually a term for what you're saying. So normalized deviance is what it is when everyone goes above the speed limit at the same rate, and it becomes a danger for you to then drive the speed limit.
Yeah. So otherwise, between Colorado Springs and Denver, I would be driving 65, except I would get killed and somebody else would too.
That makes you a normalized deviant.
Yeah. Well,
they're the norm. They're the ones normalizing deviance.
The deviants, yeah,
because they're normalizing above the speed limit,
and they have.
But that
They've
becomes
accomplished
normal.
That.
He's the deviant.
But I just want to say, Jennaya, if you're outpatient therapist and you're making 13 visits a day, you must be speeding.
Don't ask, don't tell. She was in the Air Force.
I don't speed. I try not to.
Okay. You have to say that. Good. But anyway, so it seems like you're right, Al, so I might have to change my ways
Just
a little
don't
bit.
be that normalized deviant. That's all I ask, Dave.
But meanwhile, we need to get some cool people to drive the speed limit so we can re-normalize normal. And one last thing about that, it says reasonable. If I'm driving at a speed less than the normal and reasonable speed of traffic, I could fight it in court and I could say it's unreasonable to speed.
Yes.
That won't win in court because here's why, and you guys need this lesson on how we adjust speed. It's called the 85th percentile. And they do traffic studies all around the country, but even here in Colorado Springs, to see what the 85th percentile, that's 85% of the people driving, what do they do? And if they're driving 10 miles an hour over the speed limit, it's incumbent upon the engineers to adjust that speed. Because for whatever reason, drivers have said, by their actions, it doesn't feel right to go 40 miles an hour in this stretch of road that is straight with unlimited vision and really no intersections. So that 40-mile-an-hour speed limit is the speed limit, but it's not reasonable. And the engineers are supposed to change it.
That makes sense.
It's still the law. You can get a ticket for violating that sign, but it's unreasonable. So it's a morphing kind of thing.
See, I don't think it should be considered unreasonable for me to drive it such a way that I am not going to get a ticket. You know, I could drive as fast as they
so get in the
want
right
me to,
lane,
but I could get a ticket. I could get a ticket.
Turn your flashers on and drive the speed limit.
I'm just going to have to move to an Amish community, I think. And
David's speed, too. It's just the horse only goes so fast.
I know, and that's true because, you know, sometimes you're driving down a road and you look down and you're like, oh my gosh, I'm going so fast. Like, I didn't feel it, right? Because it's a straightaway, no one else is there.
Sure.
So it happens.
Yeah. It does happen.
So we'll continue to visit this subject from time to time. Thanks for weighing in, Jennaya. And I'm glad you're driving the speed limit from patient to patient. Anything else out before we wrap it up?
No, this was a fantastic session.
Thank you, Jennaya, so much for joining us.
Thank you for having me.
Look in the show notes for links so that you can find Highroots Wellness and volunteer, donate, especially if you're a very wealthy philanthropist that wants to change the world right here in our community. One good way to do it.
And healthcare is running scared these days, so they should think about it.
Well, thanks for listening to Loving the Springs. Follow this podcast to keep up on
what's going on,
what's going well,
and what's going wrong.
Share it with your friends, family, and colleagues, too.
And be sure to visit studio809podcasts.com to check out all of our fine community podcasts. Find your new local favorite there.
And you can listen whether you're driving the speed limit or not.
In the Pikes Peak region, there's no shortage of activities. Whether you're experiencing breathtaking parks or magnificent works of art, if you're getting fashionable at a film festival or fresh at a farmer's market, if you want to hear the sweet sounds of a symphony or the smooth shred of a Stratocaster, look no further than Peak Radar, your one-stop shop for all events in the Pikes Peak region, your free source for viewing and posting events. So no matter how you engage with our beautiful region, visit peakradar.com and get plugged into the peak.